I'm now going to turn to Dr. Dayna Johnson, who is a sleep epidemiologist and assistant professor in the Department of Epidemiology at the Rollins School of Public Health at Emory University. Dr. Johnson?
Thank you, Dr. Manley. Next slide, please. I have no conflicts to disclose. Next. So my talk is focused on understanding the sleep, environment, sleep, and CNS disorders, and really thinking about interventions. So sleep is an important determinant of health. And when we sleep, there are several physiologic activities that occur. Next. And so these activities are necessary for memory and learning, emotion regulation, immune and inflammatory function, metabolism, and cardiovascular. So, despite the importance of these different factors related to sleep, we see that there's a high prevalence of adverse sleep health as well as undiagnosed sleep disorders, particularly here in the US. And we also see that these are disproportionately more common sleep problems among racial ethnic minority groups. Next slide, or next. Thank you. And so we cover sleep health, so including short sleep duration, poor sleep efficiency, and other sleep difficulties, in addition to sleep disorders such as insomnia and sleep apnea, that is associated with a number of adverse health outcomes, including cognitive decline, dementia, cardiovascular risk factors such as stroke, as well as mortality. So this all points to sleep as this vital component to our quality of life. Next, please. Understanding some of the determinants of poor sleep, as well as some of the determinants that are contributing to the racial ethnic disparities that we're seeing in sleep, we point to the environment as important factors. And so that includes both the social and the physical environment, including different features. And so some of the work that I've published, we've shown that different features of the physical environment, such as noise, as well as living in areas with a higher population density, as well as intersection density, is associated with shorter sleep duration and also poor sleep quality. And we see that with looking at the environment relation to sleep, that is particularly salient for racial ethnic minorities. So our data has shown that individuals that are from historically minoritized populations, that we see an association between the neighborhood environment and sleep only among those groups and less commonly among non-Hispanic white individuals. Next. And so, as Dr. Williams so eloquently stated, we really look at structural discrimination or racism as the fundamental cause of these disparities that we're seeing. And so when I mention structural discrimination, I'm really talking about these macro level conditions that limit resources for certain individuals. And this is often seen through different policies. Redlining was mentioned, and that's an important example, really shaped and created residential segregation. And that segregation by race, ethnicity, socioeconomic position, and immigration status, which can bidirectionally relate to inequities in resource distribution. Next. And so we see that these different factors differential access to the physical and social environment. And so individuals, because again of these different racist policies, were forced to live in an environment, and this has persisted over time. And so we see that certain individuals that live in more disadvantaged neighborhoods are exposed to these adverse features that are adversely affecting sleep and other health outcomes. Next. And so the environment and likely intervention targets for improving sleep health. Next. Next. And so here's an example of an intervention with just taking parts of the environment and cleaning them. So these show the before pictures. And from this intervention, next, they observed reductions in crime, vandalism, safety, and then increases in socialization. So these are all factors that I previously shown on the last slide that are related to adverse sleep health and other adverse health outcomes. Next. And so another intervention that we're currently doing is looking at weatherizing homes as an intervention factor to improve sleep as well as cognitive function. And then there's other policies that can be targeted in order to reduce these structural barriers to improving health. So thank you for your time.
Thanks very much, Dr. Johnson.